السلام عليكم. اليوم راح أشرح أو راح أبتدي في مادة الباثوفيسيولوجي. الليكشر هذه حتكون Introduction to Pathophysiology، مقدمة لعلم أمراض وظائف الأعضاء. مثل ما نعرف إنه باثو بمعنى disease أو مرض، and physiology معنى الفانكشن of البودي، الفانكشن of البودي أو different functions. بمعنى إنه علم وظائف الأعضاء فيسيولوجي، الباثو مرض، علم أمراض وظائف الأعضاء. Terms used in pathophysiology. المصطلحات اللي تستخدم في علم أمراض وظائف الأعضاء. Pathology. We all know that logy means a study of. Patho means disease. So pathology is a study of disease. Pathogenesis, the development of disease. Pathogenesis is the development of a disease. تطور المرض, development of a disease. A disease develops in stages. How does a disease develop? Diseases develops in stages. المرض يتطور أو يتم في مراحل. Infectious disease example. الأمراض المعدية لها stages أو have infectious diseases have specific stages, which are the incubation and the disease or illness and the convalescence. Incubation, it's the time between the initial infection and the appearance of any signs or symptoms. هي المدة اللي تكون ما بين حدوث العدوى وظهور الأعراض. once أو بما أنه ظهرت الأعراض والإشارات, appearance of the signs and symptoms is the disease or the illness. The last stage of the pathogenesis is the convalescence or recovery or regains strength and a normal body function. Pathophysiology. Pathology, study of disease, but pathophysiology is the study of the functional changes associated with a specific disease. Pathophysiology is more specific than pathology because we study the functional changes, التغيرات الوظيفية. physiology وظائف الأعضاء. احنا بنستدي of the functional changes. ندرس تغيرات الوظيفية اللي مرتبطة مع مرض معين, associated with specific disease. How the disease affects specific functions of the body. In another way or another meaning, we study how a specific disease can affect specific functions of the body. Specific diseases, or how the disease can affect specific functions of the body. Subjective findings. the patient's symptoms. And these we all know that these symptoms are experienced by only a patient. For example, like swelling, pain, or nausea. Patients can only experience these symptoms. Described by the patients. For example, the patient's history. Objective findings by the physical exam, measurable and observable. By the physical exam, we can see them with the naked eye and we can measure them. Health providers' findings. Occurrence of disease defined by two factors. حدوث المرض يتم تعريفه عن طريق عاملين. الانسيدنس. What is incidence? Incidence is the number, the symbols mean number of new cases per unit of time. So what is incidence? It's the number of new cases of a specific disease per unit in time. For example, I want to know the number of new cases. For example, I have got 10 cases in a week per unit of time. The prevalence, number of new and old cases per unit of time. So incidence, number only of new cases. Incidence in number of only new cases, but the prevalence is the number of the new and old cases per unit of عدد الحالات الجديدة والقديمة لكل وحدة من الزمن. الانسيدنس عدد الحالات الجديدة فقط لوحدة من الزمن. Disease terminology. Etiology means the cause of a disease. Cause of the disease. Idiopathic. So when you hear that, for example, she got an idiopathic disease, like she got a disease with unknown reason or unknown cause. So idiopathic, she got an idiopathic disease, like she got a disease with unknown cause. And iatrogenic disease caused by the human intervention عن طريق تدخل الإنسان. مرض محدث عن طريق تدخل الإنسان. That's iatrogenic. We have idiopathic, iatrogenic disease caused by human intervention. Idiopathic, a disease with an unknown cause. Iatrogenic and idiopathic. Iatrogenic disease caused by the human intervention. Congenital disease within born. Congenital diseases أو الأمراض الخلقية. Congenital diseases أو الأمراض الخلقية. Diseases occurring at birth. أمراض تحصل عند الولادة. Diseases occurring at birth. السندروم. What is a syndrome؟ أو تسمى بالعربي أو ترجمتها هي ظاهرة، لكن ما هو الترمينولوجي؟ common cause of different size and symptoms. So السندروم أو الظاهرة common cause مسبب متعارف عليه، يعني السندروم common cause of different size and symptom. Common cause syndrome, common cause of different size and symptoms. Remission, What is remission? Remission period when the symptoms and the signs of a disease abates. Remission اللي هي البيريود، هي مدة لما السيمتوم والساينز of specific disease abates، يعني تتناقص أو تقل. Remission هي period when the symptoms and the signs of disease abates. السيندروم هي ال common cause، المسبب الرئيسي of a different symptoms and signs. Exacerbation period when the symptoms and signs increase, not abates. Exacerbation is different than a remission. A remission period when the symptoms and signs abates, but exacerbation a period when the symptoms and signs increase. Exacerbation a period when the symptoms and signs increase. Endemic disease. Endemic disease, a disease native to local area. Endemic disease, a disease native to a local area. الديزيز يعني المرض يعود أو أساسي في منطقة محددة أو في مكان معين. الendemic disease, a disease native to a local area. A disease native to a local area. Epidemic, many people affected in a given area. Many people, كثير من الناس affected within in a given area. في منطقة يعني محددة، في منطقة محددة. endemic disease, a disease native to local area. Epidemic, many people affected in a given area. Pandemic, many people affected in large area, not only in a given area, not only in one area, no, in large areas، في مناطق كثيرة، في مناطق كبيرة. الانكيوبيشن طبعا احنا عارفين incubation a latent period of the disease before develop signs and symptoms. هي latent disease أو initial البدائية. incubation أو فترة الحضانة هي latent period of the disease before develop signs and symptoms. الprognosis هي the probability of recovery. So what is a prognosis? A prognosis is a probability or an ability for recovery. Prognosis is the probability for recovery. Morbidity, disease rates within a group. Disease rates within a group. Morbidity, disease rates وقيم المرض أو المرض في منطقة معينة، يعني قيم أو معدل المرض في منطقة معينة. morbidity, disease rates within a group. mortality هي death rates within a group. Epidemiology, how the disease occurs and spreads through an area. So what is epidemiology? Epidemiology, how the disease occurs، كيف المرض يحصل وينتشر خلال مكان معين. How the disease occurs and spread. How the disease occurs and spread through an area. Predisposing factors or risk factors. Predisposing mean risk. So the predisposing factors or risk factors, we have age. First risk factor is the age. Age play a major role. So age, young are prone to accidents. Young people are prone to accident. prone من هم أكثر عرضة to accidents. young are prone to accidents. Getting diseases such as diabetes, heart disease, and certain cancers increase with age. So as we increase in age, the chance to have or the chance to getting disease such as diabetes, heart disease, and certain cancers are increasing with increasing age. And when I say the young are prone to accidents. Very old are prone to drug interactions. People who are very old, they are prone to drug interactions. People which are very old are prone to drug interactions. Sex. More frequent in women. Some diseases are more frequent in women, like osteoporosis. And as we know that osteoporosis is decreased in the bone density, and extraporosis between the osteoid matrix, and it's make the bone more prone to fractures by يعني عن طريق الحركات اللي مرض هشاشة العظام عبارة عن قلة في كثافة النسيج العظمي. كثافة النسيج العظمي تقل وتحدث فراغات يعني واضحة، فراغات يعني عن بين الخلايا العظمية يعني، فبيؤدي إلى سهولة حدوث كسور يعني عن طريق القيام بأي حركات اعتيادية كالانحناء مثلا. العطس ممكن كمان يسبب فراكشر يعني. فهو طبعا more frequent in women. ليش more frequent in women؟ لأنه الومن after يعني بعد سن انقطاع الطمث أو المينوبوز، ما يسمى بالمينوبوز، يقل إفراز. طبعا حيكون ما في menstruation، وبالتالي ما حيكون في استروجين، إفراز الهرمون الأستروجين والبروجسترون كالسابق. وطبعا هرمون الأستروجين هو مهم يعني في يعني تكوين العظام وقوة العظام. فلما يكون في قلة في الاستروجين برودكشن يعني في المينوبوز، حيكون more frequent in women than men. فالاوستيوبروسيس طبعا في امراض تعتمد على السكس، في predisposing factors and age and young are prone to accidents. Getting diseases such as diabetes, heart disease, certain cancer increase with age. Very old are prone to drug interactions. Lifestyle. Example of a harmful lifestyle. طبعا اللايفستايل أو النظام الحياة يعني يأثر بشكل كبير يعني على حدوث المرض يعني. فعندي الهارمفul أو العادات السيئة يعني السموكينج، التدخين، excess alcohol، الشرب يعني شرب الكحول يعني، البور نيوتريشن، التغذية السيئة، التغذية الفقيرة ببعض العناصر الغذائية، السيدنتري اكتيفيتي، الخمول أو الكسل، السيدنتري اكتيفيتي الخمول، عدم ممارسة الرياضة، من predisposing factor، من الريسك فاكتورز. طبعا عندي الانفايرومنت أو البيئة. ممكن الانفايرومنت عامل من عوامل الخطر أو من العوامل اللي تسبب المرض. عندك الاير بولوشن. البولوشن هو تلوث الهواء. الووتر بولوشن تلوث الماء. البور ليفينج كونديشنز. الأوضاع الفقيرة، الفقر يعني الفقر ممكن إنه يسبب عامل من عوامل الخطر. الاكسسيف نويز، الضجة أو الإزعاج يعني الزائد عن حده. الكرونيك سايكولوجيكال ستريس اللي هو الأمراض النفسية يعني المزمنة، الأمراض النفسية المزمنة، الاكتئاب المزمن. الهيريديتي. ما معنى هيريديتي؟ هي الوراثة. الوراثة عامل من عوامل الخطر. كيف عامل من عوامل الخطر؟ deals with genetic predisposition، inheritance. طبعا في بعض الأمراض مثل ما نعرف إنه تكون جينية أو related to heredity inheritance، زي الداون سيندروم، زي الأنيميا، فهذه كلها heredity. الهيريديتي هو factor في ال risk factors في ال preventive health care. The best treatments of a disease prevention. So preventive health. So what is the best treatment of disease prevention? If I can prevent the disease from occurring, what could be better than this? So the best treatment of a disease is a prevention. Deals with altering risk factors that can be changed. ممكن انه بعض عوامل الخطأ اقدر اتحكم فيها، يعني ممكن الهيريديتي اقدر اتحكم عن طريق الهيريديتي مثلا. يعني عشان مثلا يعني الهيريديتي ما اذا انا كنت مثلا carrier for specific disease or have a specific disease, I can control the transmission of this hereditary disease to my future offspring. So now I'm preventing by making experimental analysis before getting married, so by that way you can prevent the transmission of that genetic disease to your offspring. And by environment, I can avoid air pollution, I can avoid water pollution. Some like ministries, like the health ministry, can give ways or give instructions, and these instructions can decrease air pollution, water pollution, excessive noise, chronic psychological stress. We can all control this thing. We can preventive health care. As I said, for example, more frequent osteoporosis, we can like have more of calcium, vitamin D, so that I'm trying to prevent myself from getting an osteoporosis, more frequent in men, like gout. Gout is precipitation of gout is like when you have excessive acidity between your joints, can cause gout or Parkinson's disease. Parkinson's disease is a genetic disease and it's common in men more than women. Lifestyle, I can stop smoking, I can stop drinking alcohol, I can have a healthy diet. So preventive health care is very important. The best treatment for disease is prevention. Homeostasis. What is homeostasis? The definition of homeostasis: internal constancy, or a stable internal environment. So homeostasis is the stable internal environment. استقرار أو ثبات البيئة الداخلية أو الثبات الداخلي. Homeostasis هو internal constancy or the stable internal environment. Or a body imbalance is when a body أو لما الجسم يكون في حالة اتزان، هذا هو التوازن أو homeostasis. A body imbalance is in homeostasis. A body imbalance is in homeostasis. Homeostasis and a disease. Homeostasis and a disease. A disease is the failure to maintain a homeostatic condition. So what is a disease and what is the relationship between a disease and a homeostasis? A disease is the failure to maintain a homeostatic conditions. So disease is the failure to maintain homeostatic conditions. And a disease mechanisms. How should a disease happen؟ أو آلية المرض. A disease mechanism. آليات المرض. A disease can be genetic, as we know, like the anemia disease is genetic, and like Down syndrome. Mutant or abnormal genes. This genetic disease is about muted or abnormal gene. جينات غير طبيعية أو فيها طفرة. الباثوجينز, the microscopic organisms. Pathogens are the microbes or microscopic organisms called pathogens. They can cause damage. And genetics may be muted or abnormal genes. Loss of control mechanisms. Loss of control mechanisms like diabetes and immune problems. Loss of control, فقد التحكم. Mechanisms, loss of control, like diabetes. What do you know about diabetes? The pancreas secretes insulin from the beta cells, which are localized. Beta cells are localized in the pancreas, and the pancreas and these beta cells secrete insulin, and insulin is responsible for converting the sugar into energy, carbohydrates into energy, so that the cells can use it in different functions. But in the case of diabetes, we have two types of diabetes: type 1 diabetic and type 2 diabetes. Type 1 diabetes, like it's most or what common about is that they don't have beta cells. They cannot secrete insulin at all. So there is a problem to the beta cells within the pancreas. And the type 2, they secrete insulin but not in sufficient amounts. They secrete insulin but not in sufficient amounts. So we have loss of control mechanism, loss of control mechanism, and of course we have immune problems. Degenerative changes. Our normal aging. For example, we have a normal aging. While getting aging, this is a cause of disease. Getting old in age make you more susceptible to diseases. So this is an example of degenerative changes. Degenerative changes like normal aging. Environmental hazards like trauma, chemicals, like chemicals can cause cancer. And so we have environmental hazards like chemicals. And we have also nutritional factors or malnutrition can cause disease. And tumors, benign and malignant. Tumors like cancers. There are two types of tumors: benign, which is not a cancerous cell, and malignant, which is a cancer cell, which is very critical. And the cell and disease. The relationship between a disease and the cell. Changes in a growth. A cell can changes in a growth. This is abnormality when a cell changes its growth. It changes in the size of an individual cell. For example, if I have a cell and it is changed in its size, that's abnormal. We have atrophy. What is atrophy? Atrophy, decreased cell size. So atrophy is decrease in cell size. What is atrophy? Atrophy is decrease in cell size. And what is hyperatrophy? Hyperatrophy, increase in cell size. So atrophy, decrease in cell size. Hyperatrophy, increase in cell size. We have like hyperatrophy. A good example of hyperatrophy is building. When you build your muscle by working or by eating more proteins to build up your muscles, and your muscle cells become hyperatrophy, become much bigger, increase in its size. So this was in changes in growth. changes in the size of an individual cell in one cell. And now it changes in the actual number of cells. We have changes in the actual number of cells. تغير في العدد الفعلي للخلايا. في عندك hyperplasia, dysplasia and anaplasia. What is hyperplasia? Hyperplasia increase in number of normal cells. I have normal cells and they increased in number, so that's called hyperplasia. Hyperplasia is the increase in number of normal cells. Normal cells, you know what? You have increase in number of normal cells. Dysplasia increase in number of atypical cell. We have your picture showing you the dysplasia atypical cell, but you have here hyperplasia increase in number of normal cells. These are normal cells, but in dysplasia increase in numbers of atypical cells, unsimilar cells. Here's a normal cell and here's a damaged cell, so we have increase in atypical cells. And this is hyperatrophy, increase in size of a cell, increase in the size of the cells. In atrophy, here as we discussed before, is about decrease in cell size. So dysplasia increase in a number of atypical cells, unsimilar cells. Hyperplasia increase in a number of normal cells, one type of cells. Anaplasia increase in number of frankly abnormal cells, increase in number of frankly abnormal cells, like here atypical cells. Dysplasia, like we have like here cuboidal epithelium, and here we have a squamous epithelium. They are increasing atypical cells. Here increase in normal cells, increase in number of normal cells, but here increase in a number of frankly abnormal cells. Frankly abnormal cells, as we see here, you have like abnormal cells like this and this and this abnormal cells. It changes in a type of cell. A change of one type of cell into another type, which is called metamorphosis or metaplasia. Metamorphosis or metaplasia. What is metaplasia? Metaplasia is a change of one type of cell to another. For example, if I have a epithelium cuboidal cell, and it changes to, for example, another type of cell, that's obviously a disease. And I'll tell you an example of this. See here, metaplasia. Metaplasia here, you have normal cells, which is a columnar ciliated cell, and they change to different replacement cell, like a cuboidal epithelium cuboidal. I give you an example. Like smoking, when you smoke, a damage. For example, we all know that in the bronchus or the bronchus tissue or cells are ciliated columnar. They are ciliated columnar. By smoking, a change or metaplasia occurs. By smoking, metaplasia occurs. So the ciliated columnar cells become columnar. They become columnar, for example, يعني not ciliated. And we know that these cilia move up. They move up. So when you smoke and toxins arrive or resist or in your lungs, when you, for example, cough and try to expel out mucus, and the mucus is expelled out by the way of your mouth by these cilia, So when this cilia disappears, that's called a disease. So that is a side effect of smoking. Okay, cell damage is the main reason to lose homeostasis. So cell damage is the failure to cause to maintain homeostasis conditions. So cell damage is the main reason to lose homeostasis. So what is the main reason to lose homeostasis or internal consistency? It is the cell damage. For example, we've got an example here: deficiency of oxygen, which is called hypoxia. Hypo means decrease, oxia means oxygen. So deficiency of oxygen, hypoxia, most common reason من أكثر العوامل، يعني أكثر الأسباب. الميكانيزم of progression, the mechanisms of progression. So when you have hypoxia, what the diseases that can be produced by hypoxia? We have ischemia, we have necrosis, and we have gangrene. Ischemia is like when a specific tissue in the body or specific part in the body can't receive oxygen or can't receive enough oxygen to breathe or to live. So that's called ischemia. Necrosis, after the cell die, it becomes like necrosis become, and there are different types of like gangrene, necrosis, and what else? We have different type of necrosis will be discussed later. And we have gangrene. Gangrene is like the death of or gangrene toxins inside within a specific part of the body. So these are the diseases that may be produced by deficiency of oxygen or by hypoxia: ischemia, necrosis, and gangrene. Ischemia, necrosis, and gangrene. Ischemia to necrosis to gangrene. So for example, when you have ischemia can lead to necrosis, and necrosis can lead you to gangrene. Okay? السيل death موت الخلية. Once it occurs، بما أنه حصل مرة، lysis occurs with release of lysosomal enzymes. This causes inflammation. Once cell death occurs, lysis happens. Lysis occurs. Once cell death occurs, lysis occurs with release of lysosomal enzymes. These lysosomal enzymes cause inflammation. Lysosomal enzymes cause inflammation. Chemical mediators like the histamine. Sorry, here we have the treatment. A diagnosis and treatment. SOP protocol or SUB protocol. S means subjective, O objective, A assessment, and P plan. So how can a diagnosis and treatment? There is a protocol which is called SOP. SOAP. S means subjective. What is subjective? The symptoms by the patient, experienced by patients. Objective by healthy providers, and for example physical exam, which is for diagnosis. Assessment and plan. Assessment and plan. Subjective findings, the patient's symptoms. symptoms. So what are the subjective findings? They are the patient's symptoms. Obtained by taking a medical history. Obtained subjective finding, the patient's symptoms. How can I take the patient's symptoms? By taking a medical history of the patient. Includes a chief complement, CC, present illness, chief complaint, present illness, past history, mid-surge allergies, lifestyles, like the past history, if have medication before, if it taken a medication before, had a surgery before, if the patient had allergy from something, its lifestyle, this past history, and present illness, المرض الحالي مثلا, chief complaint, present illness, past history, family history, and review of systems. So subjective finding, the patient's symptoms, obtained by taking a medical history. What is a medical history? A medical history includes chief complement, CC, present illness, patient or past history, family history, review of systems. Objective finding, the patient's physical manifestations معناتها مظاهر. patient's physical, المظاهر الجسمية للمريض, the patient's physical manifestations. Then vital signs, T, pain. Go from head to toes. I have to check the patients. I have to see the patient's physical manifestations from head to toes. The vital signs, like what is the vital signs? Temperature. I have to check the vital signs. What is the vital signs? The vital signs like the temperature, pressure, blood pressure, pain. So we have to check the vital signs, which are temperature, pressure, blood pressure, the brain. Includes techniques of inspection, osculation, palpation, and precaution. Inspection includes the techniques of objective findings, include the techniques of inspection, توقع أو التخمين, الأوسكيوليشن, طريقة الاستماع لضربات القلب, البالبيشن, التحسس, يعني تحسس على مناطق معينة في الجسم, osculation, palpation, inspection, precaution. Assessments or arriving at a diagnosis. What is assessment? Assessment is arriving at a diagnosis. So assessment is arriving at a diagnosis. So assessment is arriving at a diagnosis. Differential diagnosis include all possibility. A diagnosis should be include all possibilities. كل الإمكانيات لازم تكون في التشخيص. Differential diagnosis. Lab, basically a study of the body fluids. Assessments, arriving at a diagnosis. You have like a lab, basically study of the body fluids. Diagnostic tests. What are the diagnostic? Like imaging, X-ray, US magnetic resonance imaging, isotopic scans, like imaging. Diagnostic test. A lab, basically a study of the body fluids. Arriving at a diagnosis. What is arriving at a diagnosis? It's an assessment. Differential diagnosis, like includes all the possibilities. A lab, basically study of the body fluids. A diagnostic test, imaging, endoscopics. الاندوسكوبيكس البايوبسيس in the skin testis biopsies like الوخز biopsies الاندوسكوبيكس البايوبسيس السكين تيست الاميجينج like الاكس راي المagnetic resonance imaging الisotope scans. Last thing is about the plan or treatment. The plan all possible treatments with associated complications and prognosis. So what is a plan? All possible treatments كل العلاجات الممكنة with associated complications مع أشياء معينة يعني و prognosis includes a treatment plan خطة علاجية. The plan includes a treatment plan. Include a treatment plan. There's two types of treatment plan. We have two types of treatment plan. We've got two types of treatment plan. Individualized by the same patient by taking directed medications by the doctor. This is individualized. And modalities available like treatment plan can be surgery, can be medication, or can be individualized by you can do something by yourself. So this treatment plan, and it can be medication. It is called modalities available, medication and surgery. And that's the end of the lecture. Hope you understand and enjoy. Thank you.